Hello, I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multi-Speciality and Urology Hospital, Bangalore. Welcome to my channel, Urology for Everyone. In this episode, I will be going deeper into dialysis. I have already covered what is dialysis, the complications of dialysis, and also some details of the dialysis in my previous videos. Today, I will be discussing an important way in which dialysis is done, that is peritoneal dialysis. To recap, dialysis is of two kinds. One is hemodialysis, second is a peritoneal dialysis. Hemodialysis is when the dialysis is carried out by taking impure blood, cleaning it and putting it back into the patient's body. Peritoneal dialysis is a second category of dialysis wherein a catheter or a plastic tube is inserted in the patient's abdomen or the peritoneal cavity, and a solution called dialysate is instilled in the peritoneal cavity. This solution sucks out by a process of osmosis the impurities in the plasma. Things like urea, creatinine, ammonia, etc., and some electrolytes also through the peritoneal membrane. And this impure fluid, it is not blood, it is only impure fluid, is drained out after a few hours and is discarded. So the number of hours that this fluid is kept in the abdomen is called the dwell time. It could be about 4 to 5 hours, and at the end of it, it is discarded. So the advantage of peritoneal dialysis is the dialysis can be done by the patient himself at his own home. In hemodialysis, he has to go to the hospital thrice a week, spend a few hours in the hospital with all its inconveniences. So peritoneal dialysis is more convenient than hemodialysis. If that is the case, then why hemodialysis is more popular than peritoneal dialysis? That's because hemodialysis is safer to do than peritoneal dialysis, and it is done by the technician or a dialysis technician in the hospital, whereas peritoneal dialysis has to be done by the patient himself, and who has to be trained, who has to have some understanding and education to take care. What are the complications of peritoneal dialysis? The biggest complication of peritoneal dialysis is the fear of infection, which is infection of the peritoneal cavity, which can spread to the blood. This is called peritonitis. So if the dialysis is carried out under unhygienic condition, or if the patient's general condition is not good, or if the diabetes he has is uncontrolled, all these things may lead to severe infection, and that needs either antibiotics at home, or in severe cases the patient has to be hospitalized. The second reason why peritoneal dialysis is less popular than hemodialysis is the expense. Hemodialysis costs about 1,500 rupees per session, whereas in peritoneal dialysis, first a catheter has to be put in the abdomen by a surgical procedure, and each time the dialysis is done, the average costs come to about 2,000 to 3,000 rupees. Of course, it's not that the patient has to pay each time. There are companies who have some MOU with the patient wherein he pays them some bulk upfront money of a few lakhs, and then they take care of his dialysis needs. But the upfront cost is about a few lakhs, maybe 2 lakhs, 3 lakhs, sometimes 4 lakhs, depending on the company. The third reason why peritoneal dialysis is less preferred is the patient has to be educated and aware, both, so that the infection complications are avoided. These are the reasons why hemodialysis is more popular, but peritoneal dialysis is a very good alternative in those patients who want to lead an active life, because they can do the peritoneal dialysis in the night time, and in the morning they can go to their normal activities, go to the work, they can travel, again come back in the night and do the peritoneal dialysis again. So in those patients who want to lead a natural and active life, this is more popular. So thank you for watching this video, and see you again next time.